had a chance to meet with Miss Patient X. She's 29 this year, and she told me that every time she bites on something, she would feel a sharp pain, and that pain would last for the whole day. As you can see, there is some facial swelling and asymmetry, and she said it felt hard like an eraser. So thinking that it was some simple dental problem, she decided to go get it checked. And instead, she was directed through a series of unfruitful dental visits before coming to our center, a leader in specialist oral health care. And it turned out to be a nightmare for her. The dentist found a large radiolucent mass in her lower left jaw and asked for an incisional biopsy to be taken. She had to wait for 7 days, and it was really torturous just waiting for the outcome. She was scared, she couldn't sleep, and she said it was like a death sentence. So it turned out that she was diagnosed with this condition called an ameloblastoma, which is a rare benign tumor sitting in her lower left jaw, and this meant that she had to resect almost the entire part of her left jaw. Not only that, the surgeon had to take bone from her leg and shape it to fit the jaw contour and have the blood vessels connected together. It was a long and complex surgery, but it gave her a full reconstruction of a segmental jaw defect. Her new jawbone now is free of abnormalities, and she did really well without complications, so she was discharged after 7 days. But she still had to rely on people and had to be on crutches, on walking frames for a few months. It's been 1.5 years now, and she is back to leading a normal life. She can run and she can swim, but she says she has to live with a very big scar on her leg. And she said, regrettably, no more skirts for her and only pants, and that her leg is not as strong as before. Well, ladies and gentlemen, the fibula-free flap strategy has certainly shown much success in reconstruction of jaw defects, but can we do it in a simpler fashion such that we can have better patient outcomes and also restore patients' quality of life earlier? We would like to introduce to you the idea of a mandible endoprosthesis system, and we have developed a few designs and moving on to our 3rd generation design right now. So this is a titanium device that is used to replace the diseased bone, and it will be fitted to the medullary space in the remaining healthy bone. So the beauty of a modular design is that the surgeons can now select the appropriately sized modules to fit patients with varying defect sizes using standardized prefabricated components. Now, the surgery time will be reduced significantly by up to 5 hours per patient because now you don't have to take bone from your leg, you don't have to shape it and have the blood vessels connected together. And that patient also now retains mobility and his own independence. Can you imagine the patient walking out of the hospital on his own without the need for crutches, wheelchairs, walking frames? Isn't that a very beautiful idea? So I shared this idea with Miss Patient X about this mandible endoprosthesis system that we are building. And she said, I should have waited for your device. No more scar. But I told her that this is still research work in progress, but it's really very satisfying and motivating to hear from the patient herself that she would have opted for this treatment method if made available. So my name is Yu Chun, and I'm a research fellow from the National Dental Centre Singapore. I'd like to thank the team, especially to the OMS surgeons for their clinical input, and also very grateful to Miss Patient X for having dinner with me and sharing with me her very personal story and patient experience. Thank you very much.